everyone. My name is Dr. David Kowalczyk. I work with Colorado Facial Plastic Surgery. We've designed a series of educational lecture videos which are short and hopefully provide some information about some of the common procedures that we do. We feel it's really important that patients understand the anatomy and some basic concepts behind the procedures to be an informed consumer. If you have any questions, concerns, or comments, feel free to leave them at the bottom of the video on our YouTube link. We would really appreciate it. Thank you. Hello everyone. We're going to talk today about nasal assessment and some common terms that we use to evaluate your nose. So the first thing that we do in every rhinoplasty or septoplasty consult that we do is a good history and physical examination. We want to know about any past rhinoplasties that you may have had, any trauma to your nose, any medical conditions which may exacerbate your breathing troubles such as seasonal allergies, sinusitis, etc. Smoking history is really important because we all know that smoking can cause problems with breathing through the nose. And then we do a good physical examination, which includes looking at the quality and texture of the skin of the nose, doing various measurements and angles, and then looking at the septum and the turbinates inside the nose. So when we look at the nose from the front view, we can divide it into thirds. If you had seen the previous nasal anatomy lecture, you know that the upper third of the nose, so up in this area, is all bone, and then the lower 2/3 of the nose is cartilage and skin. The upper third being bone, the middle third being referred to as the midvault, and the lower third being referred to as the tip structures. This picture shows what's known as the brow tip aesthetic line. What that is considered the natural flow and beauty of how a nose should look. If you look at the medial part of the brow on each side, you draw a line. It should have a general curvature. It should narrow a little bit through the nasal bones in the midvault, and then actually flare out slightly toward the nasal tip. You don't want this line coming straight down because then it looks very tubular in nature. You actually want to have a gentle flow in and then a gentle flow out toward the tip. That's considered an aesthetically pleasing nose. When we look at the nose from the profile view, there are a number of different angles and measurements that can be taken. This oversimplifies it, but it goes over the major parameters that we look at. So the length looks from the starting point of the nose to the tip defining point. The nasal height is less important in my opinion, but that runs from the same point of the radix down to the base of the ala. Nasal tip projection is the point from where the nasal alar sulcus is to the tip defining point, or the point that comes furthest out from your face. Some physicians will end up quoting about 55 to 65% of the nasal length is what your projection should be. So if you imagine putting that line along this line, it should be about 2/3 of it is considered normal projection. I think that varies drastically based on what the patient wants and what the patient starts with. Upper lip length is something that's also important as well. We measure that from the base of the nose to the lip defining point. And then the nasolabial angle talks about rotation, or how much the nose should be rotated up or down. So continuing with the nasolabial angle. In a male, an ideal angle is about 90 to 95 degrees. For a female, it's more. It's about 95 to 110 degrees. Another line that I often look at is called the Ricketts Line. Simplistically, this is a line running from the tip defining point going down toward the chin. The 2 and 4 millimeters gives you a rough idea of about how far that line should be from the lip. Why is this important? Because we look at projection, how far out the nose should stick, and a determination of that comes from how strong or weak the chin is. In a female, we like to see that at or behind that line. In a male, we like to see it at or slightly in front of. If the patient has a weak chin, they may not be able to tolerate as much projection because it will draw the eye away from the balance of the face up toward the nose. Another important concept is columella show. So some people will complain that they see too much nostril on the side of their nose. The proper amount of nostril show should be roughly 2 to 4 millimeters. And once we've looked at the outside of the nose, we look on the inside of the nose using a metal speculum, which doesn't hurt. It just gently spreads the nostril or the soft part of the nose open so we can see if there's any deviated septum or inferior turbinate enlargement. And lastly, what we'll look at is for collapse of the external nasal valve when you breathe in. What you can see here, and you may notice this on yourself, is if you're exercising and you're breathing very, very quickly, you may collapse completely, and then you can't get any air in. That has to do from that cartilage structure we were talking about that provides support to the nose. That's important because it allows us to do a structure rhinoplasty to improve your breathing and the shape of your nose. Well, I thank you for your attention. Hopefully you learned a little bit more about what we do in terms of nasal assessment. If you have any questions, comments, or concerns, please leave them below.